Hello, Dr. Winston. How are you today?
Pretty good. I'm doing fine. Thank you.
Great. So Dr. Winston works at Direct Dental in Pico Rivera, and today we're doing an expert interview series with him, and he's an expert in dentistry and in dental implants. So we're going to ask him a few questions. So, Dr. Winston, where did you grow up?
I grew up in Pasadena.
Okay, great. What inspired you to get into dentistry?
Well, I like working with my hands, and dentistry was another modality for me to do that. So it was the natural thing for me to do, to get into dentistry.
Okay, excellent. How long have you worked at Direct Dental?
I have worked here since 1997, so that makes it about 14 years.
That's a long
17 years. Right.
Oh, 17 years, okay.
Yes.
And how many dentists work there at Direct Dental?
Okay, so currently there's 4 general dentists, and there are 2 specialists. The specialists are, one is a periodontist, which is a gum surgeon, and the other one is an orthodontist, and replaces braces.
Okay, and what services do you offer there at Direct Dental?
Mainly general dentistry and some specialties. We do implants, we do orthodontics, we do gum surgeries, we do crowns, bridges, root canals, you name it. You know, we see a whole range of procedures. We'll be able to take pretty much almost anybody, really.
Okay, and okay, that's great. So let's talk about dental implants. That's a subject a lot of people don't really understand. And what exactly is a dental implant?
A dental implant, basically, under very basic terms, it's just a replacement of a tooth. Assuming you lost a tooth to maybe decay, maybe a crack, we can replace those areas of missing teeth with implants. And most times, it looks just like a natural tooth.
Okay. Oh, great. So what makes a good candidate for a dental implant?
A good candidate?
I'm talking about like health-wise.
Well, I think dental implants can be placed on a wide range of the population. If you're healthy, obviously, it's going to be a much better prognosis. But we have placed dental implants in those with high blood pressure, diabetes. You know, it all depends. My suggestion would be talk to your implant surgeon and then have them evaluate your health, and then they can make a determination. There are lots of studies on the different health issues that invalid implants can be placed on. So,
do you also need a dental crown when you get a dental implant?
Typically, a crown will be needed. It is placed to make the implant look like a tooth, and so the crown will be the part of the implant that functions. So yes.
Right. Okay. What are the alternatives to dental implants?
Depending on the situation, you can get a bridge, which means that we crown the tooth in front and behind the missing area, and basically they're basically 3 crowns glued into one, and it's glued onto your adjacent teeth, and that's there permanently. The other alternative is maybe a partial denture or even a denture itself. So there's some alternatives.
Okay, so is there an advantage to getting dental implants over the dentures that you talked about?
Yes, the obvious advantage is that dentures come on and off. Implants are generally going to be placed and they'll be permanently in your mouth. They'll be just like natural teeth.
Okay, so the dental implants are more like natural teeth, and
correct.
They're permanent in there too.
That's correct. Okay,
great. Now I notice when I'm driving around town, sometimes I see these $3.99 dental implants. Is this the total cost of a dental implant?
I would caution for consumers out there looking for implants that some of these prices may not say the whole story. I know for a fact that some of these companies, they may advertise $3.99, $8.99. It may not include the whole implant. The implant consists of the implant itself that goes into your bone. It includes an abutment and a crown. So it may not necessarily include all of them. In addition, I would say a majority of our implants, you know, may require some bone grafting because you have to realize implants require a solid foundation to be implanted.
Okay, that's great. And now, Dr. Winston, how can families save money for, on their dental bills?
You know, I always say prevention is the best money-saving thing that you can do. If you can even if you don't have insurance, I highly urge our patients to even come in for regular checkups because if you neglect your teeth for years, when you come back and you do have your insurance, it may even cost you more because to catch up and to fix your teeth at that point maybe more than the maintenance. So maintenance is definitely going to be a money-saving measure.
Okay, so you recommend that people do the home normal care and also just come in and get their teeth cleaned and just checked up to avoid more costly problems and more painful problems too, right?
That's correct. Because if you think about it, cleanings they range. Depending on your doctor, they range from anywhere from $75 all the way to $150 depending where you go. Whereas even with insurance, if you're going to neglect, let's say you need a root canal treatment and a crown, it may cost you upwards of $1,500. Even with insurance, and if they cover half of that, that's still going to be more than the maintenance that you pay every 6 months. So I highly suggest prevention is the key.
Well, thank you very much, Dr. Winston. Now, if we have some more questions, will you be willing to come back and answer a few more questions?
Oh, certainly. I'm glad to be here. Thanks for having me, Kevin.
Okay, and so that's about it for today. And I just want to thank you.